Thank you, Madam Chair. Members, I am pleased to present this afternoon AB 543, which will ensure that people experiencing homelessness can access immediate life-saving medical services through street medicine providers without unnecessary delays or administrative barriers. I'd like to thank the Chair and committee staff for their thoughtful work on this bill, and I will be accepting the committee amendments. California's homelessness crisis has reached record levels with over 187,000 individuals unhoused, two-thirds of them unsheltered. Homeless individuals face far worse health outcomes, including high rates of chronic illness, disability, and a 12-year shorter life expectancy. While 70% of unhoused people are enrolled in Medi-Cal, fewer than 10% can access care from their assigned primary care provider, compared to over 80% of the general population. Street medicine providers are often the only accessible care, but are blocked from ordering basic services like x-rays, medications, or specifically referrals because they're not listed as the patient's assigned provider. This leads to worsening conditions, preventable emergency room visits, and higher costs, both human and financial. To address these issues, AB 543 makes three key reforms. One, it establishes presumptive eligibility for people experiencing homelessness, allowing street medicine providers to immediately enroll and treat patients. Two, it removes network barriers so that the street medicine providers can directly order medically necessary services for their patients. And lastly, creates a homelessness identifier in Medi-Cal and public assistance systems to improve data sharing, care coordination, and access to critical services. Without these changes, people are left to risk their health or face dangerously delays waiting for care. With me this afternoon, representing 175 organizations from 35 counties to testify in support of AB 543 are Brett Feldman, Director and Co-Founder of USC Street Medicine, and Jose Luis Gonzalez, Vice President of Clinical Services and Medical Director at Healthcare Plan in Action. Take it away.
Chairman Hivad, Vice Chair Valladares, and member of the committee, thank you for the opportunity to testify today. My name is Dr. Jose Luis Gonzalez. I am a primary care physician, board certified in internal medicine and addiction medicine. I am the Vice President and Medical Director of Healthcare in Action. Healthcare in Action, or HIA, is California's largest street medicine organization, consisting of 22 teams spanning across 6 counties. We provide social support, including enhanced care management and community supports to the unhoused population. We also provide primary care, addiction, and mental health services to unhoused individuals. HIA uses mobile vans to provide services to patients wherever they reside, including streets, tents, personal vehicles, and encampments. I am privileged to testify today on behalf of HIA in support of AB 543. This bill improves access to Medi-Cal coverage and services for unhoused individuals. AB 543 would allow street medicine providers to provide services to unhoused patients regardless of their primary care provider or IPA assignment, directly refer unhoused patients to specialists, and order necessary medical equipment such as wheelchairs and wound care supplies. These changes are important because unhoused patients have difficulty accessing their primary care provider due to lack of reliable phone service and transportation. In contrast, street medicine providers meet patients where they are, both physically and emotionally. I want to share a short story of a patient I met in an RV in San Diego. Mr. Gardner was referred to us by an outreach organization due to chronic bilateral lower extremity wounds. As I began changing his dressing, I asked him his story and how things had gotten so bad, partially to distract him from his pain. His wounds had been there for over a year. He explained to me that he had no idea how to get to his PCP to refer him to wound care, nor who his PCP was. So he managed the best he could. 6 months later, his wounds were so bad he was hospitalized. Upon discharge, the hospital placed an order for wound care. However, the care team would not see him in his RV because it did not have a fixed address. As I looked up, I noticed tears trickling down his face, not because of the pain, but because he was finally receiving the care he had been seeking all this time. Mind you, this is a gentleman with full scope Medi-Cal insurance. AB 543 would have allowed him to get these services much sooner. Thank you for this opportunity to testify. I will now turn to my colleague Brett Feldman to share some additional examples of how AB 543 will help our unhoused patients.
Great. Thank you very much. My name is Brett Feldman. I'm the Director of Street Medicine at the University of Southern California and Vice Chair of the International Street Medicine Institute. I've been practicing street medicine for almost 20 years. I would like to share what I've witnessed are the consequences to strict network assignment within, or strict PCP assignment within our managed care networks. Tomorrow I will go to the streets as I always do, and I will see a young lady who suffers from what seems to be seizures. Because I'm not her assigned PCP, PCP, I'm not able to order the EEG or the neurology referral that she needs, but I have to treat her as if she has that official diagnosis anyway, because if I don't, the postictal phase will leave her dazed and confused and at risk for being raped, as she has been for the past 3 years before we met. I'll also see another gentleman, and we've been working together. His hypertension's controlled, his bipolar disorder is controlled. I even have him on medication-assisted therapy, and he stopped using methamphetamines. And yet, when he sustained a hand fracture while working as an electrician, because I was not his PCP, I was unable to order him a simple x-ray or a referral to orthopedic surgeon, leaving him with a permanent disability and unable to work. And then I will also see an older gentleman who suffers from urinary incontinence and the indignity of only having 2 pairs of pants, nowhere to wash them, and no bathroom to go in. Because I'm not his PCP, I'm not able to order the diagnostic testing he needs or a urology referral to find out why he's having this incontinence, which could be related to cancer. I also can't order briefs because they're considered durable medical equipment. AB 543 solves this by allowing street medicine providers to order medically necessary services for the people we serve, regardless of PCP assignment.
Thank you so much for your testimony. Is there anyone in the room who would like to record their Me Too in support of this bill?
Thank you very much, Vanessa Kahina, on behalf of the California Academy of Family Physicians. Letter forthcoming, proud to be in support.
Clifton Wilson on behalf of the California State Association of Psychiatrists, as well as the City and County of San Francisco, both in support. Thank you.
Good afternoon, Whitney Francis with the Western Center on Law and Poverty in strong support.
Good afternoon, Kelsey Avery with SCAN. Healthcare in Action is a proud member organization of SCAN, and we are in support.
Nisette Short on behalf of Adventist Health in support.
Tim Madden, representing the California chapter of the American College of Emergency Physicians in support.
Symphony Barbie on behalf of Planned Parenthood Affiliates of California in support.
Tyler Aguilar on behalf of the University of Southern California, co-sponsor, in support.
Glenn Backus for Drug Policy Alliance, Smart Justice California, in support.
Jeff Neal representing the County of San Diego, also in support.
Chair Member Cheryl Dantas with Fumuni Strategies on behalf of Alameda County in support.
Vanessa Gonzalez with the California Hospital Association in support.
Good afternoon, Amar Rashid with the County Behavioral Health Directors Association in support. Thank you.
Good afternoon, Angie Minetti with the Steinberg Institute in support. Thank you.
Good afternoon, Danielle Bradley with the California State Association of Counties in support.
Thank you so much. Do we have any formal opposition? Any Me Too's?
Dennis Cuevas Romero with the California Primary Care Association Advocates, and also here on behalf of the Community Clinic Association of Los Angeles County. Really just want to say thank you to the author, his staff, and committee staff. We're going to be removing our opposed unless amended position, so really appreciate the work. Thank you.
Thank you so much. Bringing it back to my colleagues for any questions. Ms. Senator Vice Chair.
Rather a comment than a question. I just want to thank the author for working so closely with the opposition to try and get this to be the best bill possible, and I'll be supporting it, and just wanted to acknowledge that you've worked really hard on it.
Appreciate you. Thank you.
Thank you so much for working with us here and taking these amendments. You know, we wanted to make sure that the bill would be able to move forward should something happen on the federal side, and make sure that we have those protections, and also make sure that there's a plan in place, right, between the MCPs, the providers, to make sure you're doing it aligned and you're able to provide the services necessary. Thank you for bringing your testimony, your lived experiences. Assembly member, I try to do that in one breath like you did with your presentation, but you may close now.
No, I want to end it this way, a little bit different. But look, I want to thank the members, the staff, and everybody here who came together, and thank you to the folks who pulled off their opposition on that piece because we did amend it. Earlier this year, I had the honor to walk alongside the individuals that you see here, but we walked the sunlit sidewalks of Los Angeles side by side with the heroic USC street medicine teams in my district in Pico Union MacArthur Park. I saw courage in the eyes of an elder individual who feared that they would never walk again, and I watched hope bloom on the face of a young man when a simple bandage became his lifeline. Those moments born of compassion and carried on the breath of Si Se Puede remind me that every life is sacred, every neighbor is a precious jewel in California's crown. AB 543 ignites a beacon of hope across our state that reaches out to the unhoused before bureaucracy can say wait, that removal of network walls that block life-saving services. This bill is not just policy, it's a promise, a covenant of mercy that unfolds with each x-ray ordered under the curb, each prescription handed over without delay, each wound dressed under the open sky. Today, we have that power to rewrite destiny for thousands of Californians living without shelter, ensuring that they are not invisible, not forgotten, and never left behind. And in doing so, we answer the call of our better angels and shine a light so bright that even in the darkest night, in every encampment transforms into the morning. So thank you, and I respectfully ask for your aye vote.
Thank you, so member. We'll entertain a motion once we have quorum. Thank you for your presentation.